Hello. If you're thinking about studying homeopathy, it's worth spending a few minutes just to discuss what homeopathy is within medicine. Medicine itself is a constantly evolving discipline where skills, knowledge, and technology develop apace with one another. Contemporary treatments are built on centuries of inherited knowledge, be it the molecular modeling of active principles originally derived from plants, or the design of instruments, prostheses, and investigatory technologies, all built upon generations of innovation, experimentation, and modification. Some commentators might ask why homeopathy should survive amidst all the dazzling certainties promised by medical science. It is still, after all, a largely empirical and relatively non-technological speciality. The first observation to make is that living a healthy life, one that is defined by love, social integration, creativity, and biological wellness, is a function of many complex systems, which, although sometimes rationalizable, cannot always be manipulated into functionality by science. In order to identify the contexts and causes for illness, the homeopathic practitioner begins with the recording of complete patterns of illness, including their inherent synchronicities, trigger factors, functional contexts, and phenomenology, and by recording as close to a spontaneous narrative as possible, and noting all the modalities of expression that go with it, the medical healer not only sees generic diagnostic patterns, but also records a host of equally meaningful phenomena. These often fall outside the scope of any diagnostic label, but can be of vital importance to the well-being of the patient. The patterns of symptoms expressed by patients often mirror known symptom complexes associated with homeopathic medicines. In this way, complex human signs and symptoms without an easy label can become recognizable, meaningful, and treatable by an experienced homeopath, a practitioner of the healing art with the training, skills, and resources to identify which medicine most closely conforms to the phenomenology of their patient's illness, and which will stimulate a healing response. Our courses aim to provide practitioners from a wide range of clinical backgrounds with those very skills and resources that they need to heal with homeopathy. Our teachers are themselves clinicians with an orthodox medical training who have gone on to study and practice homeopathy within integrated healthcare environments. Collectively, our teaching team represents decades of clinical experience building on 2 centuries of accumulated observation and data. Our curriculum is based on the UK National Curriculum for Homeopathic Medicine. The Faculty of Homeopathy publishes guidelines for candidates, both for their primary healthcare certificate and also the membership examination. These documents outline what is expected of exam candidates, both in terms of their clinical background and in terms of their homeopathic knowledge. Our course is aimed to prepare eligible healthcare professionals to meet all the faculty's examination requirements, but we do not teach merely to examine. Our teaching ethos is one of enablement. We would like participants on our courses to feel that their training is appropriately structured and organized so that important principles and methodologies are covered both clearly and effectively. Beyond those fundamental requirements, we also want to support students of homeopathy in a fulfilling learning experience by providing relevant illustrative clinical case studies, tutorials, and presentations, together with opportunities for discussion and well-supported self-learning. We would like you to take ownership of this discipline, to apply it flexibly, creatively, and effectively for the benefit of your patients, and ultimately, to communicate what you learn to others. Thank you for watching.